Good morning, Minister and expert friends. I speak to you today as a physician, a fellow physician. Many of you are also physicians. I speak to you as the chairman of a biotechnology company, and many of you are involved in startups, innovation in medical tech, biotech. I speak to you as an IT startup person. I started my first IT company when I was 21, and many today are young entrepreneurs in the digital world. I speak to you as someone who is also involved in community care. I am on the board of an organization which delivers 40 million visits at home to people who are sick or very old. And I know that many here are involved in community care. I want to take us on a journey into an exciting future, the future we heard about from the minister just now, and to ask some fundamental questions, not about the center of the radar screen, but about the tremendous opportunities for innovation, startup, for creating entire new industries to transform the whole of human life on Earth. So I'm looking today at the outer edge of this exciting radar. And every health trend that we see this morning affects every other health trend. It is impossible to have a conference on medical technology without talking about the future of pharma. It is impossible to talk about the future of biotech without talking about big data and patient records. The most exciting innovations will happen in future as a result of connections between the industries in this room today. A medical tech, a biotech, a nanotech, an infotech, all working together. And we will also see that at times these different specialties will be in competition. So I will show you many examples where we have a medical technology solution and a biotechnology solution. And they are totally different, but only one will win in the future. And the question is, who will win? But there is one word which will drive the future of healthcare for the next 1,000 years. And it's not innovation, it's not biotech, it's not demographics. What is this word? This single word, of course, is emotion. It's the passion that we felt inside when we heard the inspiring words of the previous speaker about changing the life expectancy of humankind. It's the passion that we felt when we were hearing about ancient history and culture and the future. And information technology has also made us even more emotional. Let me give you an example. Because if we understand human emotion, we will understand the pressures on government budget, the challenge for physicians. This is not an ordinary science event. This is not like a telecom conference. We are talking about people's lives. I specialize as a doctor in the care of people with cancer, looking after people who were dying at the end of life, going into homes, treating pain, helping people to feel comfortable. I learned that life is short, that every day really counts, and that health is really emotional stuff. You know, if we think about the internet, imagine that you were watching TV last night and you were looking at a web page of a singer, and trying to find out how old she was. And you press on her webpage, and you wait for the webpage to load. How many seconds will you wait before you press the back button? Because life is too short. Put up your hands if you press the back button in less than 5 seconds. Okay, so we've learned that after 3 seconds, you become irritated. After 4, you think the internet is broken. And after 5 seconds, you have lost the will to live. Okay? The internet has made us very impatient. And this affects healthcare. It means that patients are looking for 5 seconds answers to health on Google. It means they want instant solutions. They want instant access to treatment. Let me ask another question. Imagine that you are calling your electricity company to get money back. And you're phoning them and it says, press 1 for accounts, press 2 for customer service, press 3 for... Put your hands up if you find that really annoying. Put your hands up if you think it should be a social crime and people who do these things should be put in prison. Okay. Now, what happened? We discovered that the internet has made us very impatient, very emotional. And health is already an emotional thing. So what happens when you put health and technology together? My friends, we get an explosion of innovation. Let's have a look. Okay, so demographics will be the greatest predictor of demand for us in every country in the world. And if we think that there are 1 billion children alive today, all of whom need health care, that means there are maybe 2 billion parents alive today who are worried about children. If we look at Asia, we see the tremendous growth of economies driving changes in demographics. If we think about the global spending on health, it will be dominated by the growth of the middle class in emerging nations, whether it's Indonesia, Malaysia, Singapore, China. And if we look at the middle class hopes for their own health and for their children, then we will see why health spending will grow so dramatically in the next 20 years. Not only this, but when we think about the movement into cities, we see also fresh demand. Over 300 million people will move from cities in China, from land areas in China into cities. Another 475 million in Africa will move into cities for the first time. And as they move into cities, they start to expect the new kinds of sophisticated medicine, and they reject the folk medicine they had before. And megacities are also creating new patterns of disease. The big threat of Ebola today comes not from small clusters in remote rural areas. It comes from the uncontrolled, explosive spread in megacities, in slums, in some of the largest places in the world, like Kinshasa, for example. And so, megacities and urbanization will drive health changes. And of course, in this country and in my own country, we face the challenge of aging, as we heard about. 1 billion people will be over the age of 60 in 10 years' time. In Italy alone, there will be around 1 million people over the age of 90 by 2026. In fact, there will be so many, thank you, there will be so many people over 90 in Italy that they will control the results of every political election for the next 20 years. Europe is dying. In many nations, in Europe, you need 4 couples to produce a single great-grandchild because the number of children per couple has fallen to around 1.5. But here in South Korea, it is even lower. We now have 1.15 children per couple in this country, which is one of the greatest health challenges that we face, and it's a similar situation in my own. You see, you either have to make babies or you have to import them, and there is no alternative. And in my country, I promise you, we have forgotten how to make them, and we don't like to import them. So, of course, we have a pressure, a political pressure, which is huge and growing. 65% of all health spending in Korea will be on those over the age of 65. Therefore, my friends, our entire event today is dominated by a single word. The first was emotion, but the second is aging. Almost all demand for health care in this great nation will be because of the birth date of the people who you see. Simply how old they are will drive health demand. And when we look at the patterns of aging, we see that in most cases, most people have many conditions. So we are talking not now about a last century model. The last century model was we treat cancer or diabetes or lung disease. No. We are now talking about a model where our entire health service really exists for people over 65 and a few children. And almost all of them have many conditions, and it's the combination of medical problems that creates the total challenge medically. So 100 million in America have multiple conditions, and these multiple conditions are 80% of all health spending, 88% of all prescriptions, 66% of the public medical care, and we will see these issues as major priorities globally. If you are a pharma startup, if you are a med tech company, if you are looking for the next big thing, then look at this list, especially if you have a solution which connects with more than one. And I will show you some examples of therapies which can drive change in 2 or 3 or 4 of these things at the same time, in the same person, for the same cost. So it's cancer, heart, brain, chronic wounds. These are huge problems in old people because of circulation. Very difficult to treat. Infections. We have a global plague of bacterial resistance. We have not seen major breakthroughs in new antibiotics since 1967. Isn't that shocking? We've seen 1 or 2. That is why we have resistance problems. Because of the lack of innovation in antibacterial therapy. It's awful. Terrible. a crisis. In my country, many people fear going to hospital because they come out with an infection which no therapy can touch. My friends, we are in the third millennium. Penicillin was invented in 1942, 1943. Why have we got this problem? And it's even worse in viruses. The reason we are scared of Ebola, of AIDS, of bird flu, is because we do not have a single powerful therapy against viruses that is as good as penicillin was in 1942. Isn't that shocking? Put your hands up if you think that is really shocking. It's terrible, isn't it? So our only real weapon today is still vaccination. Terrible. We have a huge challenge. And one of the greatest challenges is financing the research that is needed, especially in antibiotics, where pharma companies do not want to invest because there is not so much profit as in rheumatoid arthritis, blood pressure, heart disease. Pharma companies love diseases where people never get better. It's true. So we need to find new partnerships between government, universities, and pharmaceutical companies to develop these next generation tools to make the world the better place that we heard about. Pharma companies will find new blockbusters. Some say to me, the age of blockbuster drugs are over. I say, nonsense. I'll give you two examples. The first is Alzheimer's. Brain damage caused by dementia is a terrible problem. My mother-in-law has it. My grandmother had it. Dementia is now the biggest killer of women in my country. Because cancer is not so much a problem. Heart disease we have nearly solved. Dementia remains the greatest challenge in this room today for you as you get older. For most of you today, it will be one of the greatest risks to your future health. It'll be the biggest unsolved challenge for your children unless we find some big answers soon. I promise you, if a pharma company can find a solution to dementia that reduces the risk by maybe only 20%, they will have one of the biggest blockbusters the world has ever seen. Here is another example. Diabetes. In New York today, 1 in 3 babies will develop adult-style diabetes when they are still children because they are too fat. This problem is costing the US $100 billion a year in the total economy, and we need answers now. We need many new solutions to obesity, and these also will be blockbusters. So, let's have a look then at solutions. Okay. Firstly, let's look at the future of hospitals. I am very excited about the next generation of information technology, diagnostics, imaging, because it will transform disease and diagnosis. If you think how much things have changed since the old days of X-rays, with 3D imaging, which allows us to imagine what it is like inside every organ, every vessel, we can reconstruct the entire physiology of a living person. We can use that imaging connected with robots, like the Da Vinci robot for prostate cancer, which gives 3D imaging, as you know, for surgeons. I can have a surgeon in Seoul, and my patient can be in Dubai, and controlling the robot for brain surgery. It's wonderful, amazing. And microsurgery will transform the future of health in every nation, as it is already here in Korea. We are looking at a market for endoscopy of more than $75 billion a year by 2022. That is up from $23 billion in 2010. We're talking about already in the US, 125,000 stents inserted into the arteries of the heart every single year. And as these kinds of revolutions take place, we will find a dramatic fall over 20 years in the number of hospital beds needed for the same conditions. And the length of stay will continue to fall dramatically right across this country. Part of the reason will be growth of other technologies like virtual medicine, but also huge growth in home care, especially for our older citizens. They want to live in the home they love, surrounded by friends and family. They do not want to be in an institution. And so home care services will be a very rapidly growing area. Connected with this is, of course, the explosion of wearable health technology. And, of course, we have a battle at the moment between Samsung, Apple, iPhone, Microsoft to control wearable health information. It's fascinating, and it will grow extraordinarily fast. And we will see astonishing growth in the number of pieces of information that we can get, ranging from ECG to blood pressure to blood glucose to heart rate to sleep patterns, all kinds of extraordinary things. As a result, even more patients will know more about their own bodies than their doctors, because they will have the readouts. They also have Google. They also have the feedback from Apple, Samsung, Microsoft, Google. So they are interpreting their own data, their small data, in the context of big data, in real time. When they see the physician, they already have the diagnosis, probably. If they already have a diagnosis from the physician, they know more about the latest treatment, probably, than the doctor, and so on. So, and then, of course, we have this explosion of what I call do-it-yourself healthcare. You buy things and you take them home, and the devices help you to manage your own health. And we already have phones, ordinary phones, which can detect oxygen level in the blood. It's very simple, using the same technology as measuring the heartbeat. We're just looking at the amount of blueness or redness in the blood supply. And home monitoring linked to telecom is already a $22 billion a year market. If you are looking as an IT company or a telco for new startup opportunities, this has to be number one, because anybody can begin. You do not need much capital. You can have a small device or even just write a clever app, and you will start to make money. You don't need scale. You can prototype. No one has yet worked out how to do this properly, so your device has a good chance to develop something extraordinary. Look out for all kinds of other things, intelligent drug delivery, patches, of many kinds, which have ICT and pharma built into them. Biotech will drive most pharma innovation over the next 20 years. And biotech will be driven by extraordinary changes in techniques. Look at this one. This is Leica microscopy of living cells. When I trained as a medical student, we had electron microscopy to study dead cells. But the technology, as you know, allows us now to watch processes inside the physiology of a single cell inside real living tissue in real time. We can expose the living cell to a drug, and we can watch the mitochondria process. We can watch the reproduction of medicines inside gene triggers and so on. Look at this. This is a food moth larva. This is the silk gland of a food moth, and we can see cuticular and fat cells living, processing, doing things. This is a mouse retina, which is alive and is processing light. We can watch mouse retina cells activate as they are touched by photons, individual photons, triggering chemical reactions inside a living cell. Amazing. And this kind of thing is accelerating the growth of pharma and biotech. And some biotech is starting to look like nanotech. Remember me saying all these things are combining together. Let me give you an example. I am chairman of a company which has built a robot. We have built a nanotech robot, and this robot, this is a pretend, it's not a real picture, but the robot has legs. This nanotech robot is not living. It needs no energy source. It needs no food. It can survive quite a long time outside the body. This robot, when it gets into the blood, the legs have pads on them, receptors, which touch individual cells, and they can recognize, they are programmed to recognize skin cell, or heart, or brain, or lung. As soon as these receptors touch the cell, the robot engages with the cell and injects the contents of the robot inside the cell, which gives instructions, and you know where we're going. It gives instructions to the cell to reproduce more nanotech robots. I am, of course, talking about simple virus technology. All viruses are nanotech robots. They are the ultimate nanotech robot, and they are already widely causing disease and now widely used in medicine. Let's see what nanotech robots could do. We already can restore hearing or begin to repair hearing inside animals by using a virus to deliver new genes to activate new hair cells to grow inside a deaf animal. Amazing science. This is my own company's work. We have built a virus, an oncolytic virus. Why? Onco, cancer, lytic, kill, destroy. This virus only touches and destroys cancer cells in the body. It cannot cause any other cell damage. We have never seen a side effect or toxicity in a significant toxic event in human beings. You inject it into the blood, it goes straight to the cancer. A cancer cell, it infects, it destroys, releasing more virus to destroy more cancer cells. You will hear a lot more about these kinds of, what are they? They're just nanobot robots. And you can, all of us can, consider many kinds of genes which we can put inside these kinds of viruses. Now, electronic medical records will mean better decisions because, of course, of big data. But the question is, where does that data come from, and how do you automate it
And how do you protect the privacy of patients, especially when we hear about the Snowden disclosures and the CIA and the British intelligence and all this snooping by governments? It means that patients are becoming very worried about their own data. But it does mean that we will see the computer become better than most physicians at making diagnoses. This is already the case in intensive care, where we have already programs which are better than the best doctors at deciding what you should do next. Intensive care is very specialized, and we have hundreds of thousands of patients in those kinds of analyses. We've seen hospitals like Ontario, Ottawa Hospital in Ontario, they have installed 3,000 iPads. Why? To collect data and to tell doctors and nurses what to do. So big data, yes, it's very interesting, but some of the most important big data is missing. It's not in any of the patient records. Why? Because it requires another advance. You remember me saying, you cannot have a discussion about informatics without talking biotech. You cannot have a discussion about pharma without talking about telecom. Here is an example. Big data, in my view, is almost useless without one further innovation. What is it? This innovation will drive the greatest new discoveries in healthcare that we have ever seen for the next 30 years. And I'm talking about the translation of your genome. Look at the way the costs have fallen of deciphering your genome. We are soon going to see a printout for a patient for less than $5,000. I predict that within 20 years, this will be $1,000. $1,000 to gene match your patient and their medical records against a big data profile of 1 million or 2 million other patients and their patient records in less than 1 hour. Amazing. And this will provide hundreds of thousands of new targets for pharma, for biotech robots, such as viruses. And gene screening will dominate disease prevention within the next decade. In my country, we are talking about storing cells and starting to do gene screening on children from the moment they are born, starting in the next 5 years. Every child starting to collect their gene profile. We already have discovered genes for old age, for speech, for better memory, for criminality. We know that some genes are more common on death row in the United States of America. That research was confirmed this week. We have genes for obesity, genes for heart disease, genes for depression, genes for just about anything. And this means that we will also see a new industry, genetic prophecy, which will be linked to insurance companies. We will see insurance companies wanting to use genetic analysis to decide your life insurance premium. Pension companies will want to use this information to decide the cost of your pension. And this will create many ethical challenges for this industry. And you will see many regulations. One exciting area for me is organ repair. Not just giving a drug, but rebuilding an organ. And this will happen routinely. Let's look at some examples. I'm talking about using stem cells, not from embryos. That's a last century idea. We know for a fact that I can get any cell I like out of your body. How do we know? Because we know that we can take a cell from your body, take the genes from it, the nucleus. We can put it into an unfertilized human egg. Give a sharp electrical jolt, and the egg starts to divide into your identical twin baby, if those cells were implanted. I'm talking about human cloning. I am totally against human cloning, okay? But we know, therefore, that in your cells, in every cell in your body, if we can put the right chemicals around the genes inside a single cell, we can persuade that cell to do anything. The only thing that egg has, which is special, is a different set of chemicals than the rest of the cells in your body. Correct? Because I can take a skin cell, which is determined. I can put all those genes in a chemical bath in a human cell and get whatever I like. Brain, skin, muscle, kidney. So it is obvious. I predicted 15 years ago that we would start to see every human type of cell from adult cells in people's own bodies, and that is exactly what is happening. And we are already growing new teeth for animals using their own cells. We are growing new cartilage for knee joints for people using their own cells. We are repairing heart, retina to restore sight, brain, spinal cord. Just this week we had new reports of a man whose spine was cut and he is now walking. He has sensation in his legs as a result of using his own cells. Where do we get them from? Actually, in many cases we can use bone marrow cells for heart. For the brain, we have an easy place to go, which is up the nose. We have the olfactory bulb, which we use to smell. We have two bulbs, one each side. Just take one. Then you can still smell your food, and we can use the stem cells. The stem cells are pure brain stem cells. We can grow new brain tissue or spinal cord tissue from this olfactory bulb, and you don't even need a general anesthetic. It's a tiny operation. And we can grow those things for the rest of your life. Fantastic. Now, but you see, competition. I said there is often competition between two different approaches. So we have stem cells to repair the spinal cord, but we also have ICT, which to grow chips into the surface of brain. This is a picture of brain cells on the surface of a computer chip. This is a biodigital brain, which is capable of controlling the movements of someone's body if their spinal cord is damaged. So which will win? Will it be stem cells to repair the spinal cord, or will it be biodigital brains? There will be a war between these two technologies to find the solution, but we will not use them both in the same patient. Here is another example of competition. We can use stem cells to rebuild the pancreas in diabetes. Now, we've done that for a long time. The trouble is, you put stem cells into someone's body with diabetes, and they produce insulin. But they get attacked by the immune system. The same immune problem which caused the diabetes will destroy your implant. So, now we have a very clever medical technology and biotechnology partnership. Medical tech has designed a special box in which these cells can grow, but the holes in the box are too small to allow the immune system in. So the cells can be implanted in the pancreas, they live, they produce insulin perfectly, and they are never destroyed by the immune system. Fantastic. Wonderful. But they are in competition from another medical device approach, which is we put 1 month of insulin into a box, we put it under the skin, and we use your iPhone to control how much you need. Okay, only one will win. Which one of these technologies will win? Of course, we can print new organs altogether. We can use scaffolds. We can use polymers. We can print layers of tissue to build entire organs using bubble jet printing technology. Lexmark has produced a printer to build new layers of skin. It goes zhung, zhung, just spraying cells onto skin to build up new layers instantly. Fantastic. Amazing. Now, when you put all of these things together, you begin to see why life expectancy will go on growing very fast. In the last 20 years, your life expectancy has continued to improve by around 1 week every month, as you know. And I believe this will accelerate. In the next 20 years, listen, it increased by 1 week every month, not as a result of medical miracles, but just because of many small little changes. Better diet, better education, people smoking less, drinking less, more exercise. But I'm asking you, what do you think your future will be? If we start putting all of these medical technologies in place over the next 25 years, you can see it is bound to be the case that life expectancy will increase by a lot more than 1 week per month. Correct? It's for sure. Unless there is a disaster like bird flu pandemic or something. And we're also seeing a change. If you walk around the streets of this wonderful city, you cannot miss the number of shops which are trying to encourage you to improve your performance. Performance of the skin, performance of your muscles, performance, especially for women, to do with beauty, anti-aging, and so on. And we are seeing a huge shift in retail, consumer choices. In the past, they were fighting disease. Now they want to improve well-being and general health. They want to look better, that's for sure. But more than that, they want to think better too. They want to love better. They want everything better. In my country, 1 in 5 of all students are using drugs which are meant for their grandmothers to improve their memory, to help them pass exams. This is the age of performance medicine, and it's only just begun. And anti-aging will be a global obsession over the next 20 years with rapid progress. So can we stop the ticking of your biological clock? Yes, we can. How? Aging is probably a curable disease, or will become so. The question is, in the next 20 years or 200 years? Let me explain why I think this is partly true. It's not completely true, but in some respects it's true. When we look inside human cells, we see the same mechanisms of aging in almost every cell, and they are the same mechanisms of aging in earthworms, in fish, chimpanzees, insects. Almost every cell in the world contains the same aging problems. Here are 7 of them. You know what they are, of course. Yeah. The aging of nuclear DNA from mutation, mitochondrial mutation. We are talking about cell loss without replacement. We're talking about junk that builds up inside cells or outside cells. We're talking about cross-links between things like elastin outside the body with loss of elasticity and other things. And if we can touch just one of these things, then we will see an impact on maybe 20 or 30 different diseases at the same time. You cannot overestimate the importance of this. In the old days, we had pharma that is directed towards heart disease, and pharma directed towards rheumatic disease. Now we are beginning to see pharma directed towards one mechanism of aging. Why? Because 66%, 65% of all your health budget is not because of heart disease or lung disease. It's because inside every single cell there is a clock ticking. Correct? If we can slow down the clock in every single cell, just think what could happen. Let me show you an example. Mitochondria, of course, are the powerhouses of every cell. They create all the electrical power, but they are not efficient. As you get older, the power gets wasted. And scientists have discovered that if you give mice or rats small amounts of R-alpha-lipoic acid and acetyl-L-carnitine, the efficiency of the power packs goes up by about 10 or 20%. So you have old mice and rats running around mazes trying to learn the way out. You give them this stuff, the mice and rats start to run, and they learn much more quickly. What else are you doing? You are probably improving their immune system and liver function. Brain, yes. Muscle, yes. Everything inside the mouse. Every cell is being improved. The aging process is being reversed. It is hard to, as I say, to overstate the impact. Here is another example. A company called Altion produced a drug called AL711. When they gave this drug to mice and rats with high blood pressure, they found something extraordinary happened. They gave the medicine for only 1 month, and the mouse and rats were cured. The rigid heart vessels began to be elastic again, and they discovered something else. Their skin became more elastic too. The tails became more elastic. In the untreated mice or rats, I'm sorry to say this, but when they are killed, they would stretch the tail and find that the tail would break. But after treatment, they found they stretched the tail goes long, they let go, it goes doing. What? Doing? These old rats, when they died, had no wrinkles on their faces. Can you imagine a drug for heart disease or blood pressure? That means that you cannot tell if the woman before you is 90 years old or only 19. Because the drug has restored the elastin of the arteries and the skin. How extraordinary is that? Now, that's the good news. The bad news is it doesn't work in human beings. But you can see now why I say, if you can find a way to control just one common mechanism of aging, you can transform many kinds of disease at the very same time. And pharma will start to do this. Monkeys, we have monkeys that are living to the human equivalent of 170 years old, just by controlling their diet. We have mice and rats living to 170 years old, worms living to 200 years old. We are interfering with the ticking clock in many different animals. And look at this. We have found many animals do not get old. Let me say that again, in case you didn't hear me. Many animals do not age. Scientists are unable to find a ticking clock inside the cells of these animals, some of which are living to the age of 450 years old. Some kinds of rockfish live to 100 years old. Identical rockfish usually live only for 20 years. The difference is in the genes. We think all these animals probably share similar genes. If we find the gene, we can discover the protein the genes make. We can give the protein as a medicine or use a virus to deliver the gene into a human. Now, I am not saying we will have these things tomorrow, but I am saying this. You can expect many exciting discoveries about common mechanisms of aging, and some of these will begin to influence healthcare within the next 20 years. Now, as a result of all this, many health costs will fall per treatment, while total spending will rise. Now, here is the biggest reason. 24% of all health costs in this country are buying drugs. But the good news is this, that the average patent life of a new drug is only 10 years. Because, of course, it takes 15 years to bring it to market. And after 25 years, the patent is over. So after 10 years, even the most expensive drugs in the world fall in cost by between 90 and 95%. So it's just one example of dramatic cost saving that we are seeing. And in just 7 years alone, 8 years alone, we saw 3,000 patents expire in Canadian pharma alone. And then you've got things like faster healing with medical tech devices like these, the discovery of techniques to accelerate fibroblast repair of old wounds by activating telomerase. Nevertheless, funding of healthcare will continue to become more expensive, even though the cost of each treatment falls because of the aging problem. And this will be an increasingly sensitive challenge. How do you ration? Rationing of healthcare will be universally applied in every country by doctors and politicians. We are already seeing healthcare is in competition with defense, with education, with roads, with social welfare payments. And in medicine alone, we see competition, but as I have said, between different treatments. So governments decide to fund transurethral resection for prostate, but they will not fund laser destruction. So we have competition between specialists inside the same hospital with different treatments for the same condition. Then we see competition between diseases. So in my country, we have a competition between activist groups, women mainly, looking at better treatment for breast cancer. Over here, we have much fewer activist groups, mainly by men, for better treatment for prostate cancer. Competition. And a lot of that is to do with emotion, social media, activism, and now we're back to the beginning again. I said emotion will drive the future of health, especially in research and budget. And because there is competition for government funding, and because the pressures are growing in older societies, of course we will see rapidly growing demand for private healthcare and medical tourism. We have already heard from the minister about the government priority for medical tourism in Korea. And here I have some excellent news. This year, 250,000 people will come to this wonderful country for your amazing healthcare, delivered at lower cost, but at higher quality perhaps than they have ever seen before. And at the same time, they will enjoy a wonderful cultural experience. And we all know that health is far more than the operation. It's to do with the psychological well-being of the patient. Now, I expect that figure to go right up, at least twice, maybe 3 times, maybe even 4, by 2020, 2025. This is a tremendous opportunity for you to continue to market what you have. And at the same time, we will see many new ethical challenges, not just the challenge of rationing, of deciding whether there is enough money for a 98-year-old to go on a dialysis machine because their kidneys aren't working, or whether we should use the same money to improve the treatment for children with a very rare genetic disease. These are ethical challenges, but we will see many more to do with the beginning of life and the end of life. Is it right for a doctor to agree to kill a patient just because the patient is feeling depressed and because they are over the age of 75 and they feel a financial burden on their families? Is this right? For me, I say no. But these are challenges which every country, every physician, every family will find themselves debating over the next 30 years. There are many other challenges to do with the beginning of life, complex challenges. In my country, we have a debate. Is it right to create a child with 3 parents? One parent gives the mitochondria, the powerhouses, because the powerhouses are faulty in the mother or the father. And the other parents, they give the rest of the genetic code. Is this right, ethically right? Is it right to use IVF to allow a 75-year-old woman to have her first baby? Is this right? Ethical challenges. Is it right to abort a baby because we see that they are less likely to have high intelligence because of their genetic code? Is this right? Big challenges. One of the greatest ethical challenges, I believe, will be this. For the wealthy in this wonderful nation, who can look forward to increasing years of life expectancy, even perhaps turning off the ticking clock. At the same time, we have those in countries like Zimbabwe, where the life expectancy is still only around 37 years. In a country like northern Mozambique, if we had 100 women of childbearing age in this room, I would be telling them that 1 in 10 of them will no longer live in a few years because they will be dead in the middle of giving birth. 1 in 10 of all those women dying in the act of delivering a baby. And while those kinds of issues may feel a long way away, actually they come very close when we think about something like Ebola. We see 1.8 million small children die every year because of dirty water. You could say this is as much a scandal as the lack of antivirals or the lack of antibacterial drugs. In a global village, I think we are recognizing we have had an urgent reminder in the last 12 to 16 weeks that our world is a global village. And if health infrastructure is neglected in one part of the village, it can produce a global threat that could wipe out many of the advances we have been talking about in South Korea within 5 years. I'm not saying Ebola would do that this time, but future threats. Why? Because our viruses continue to be a major challenge for us, for the reasons I have described. So that is why I think we will see increasing activity to try and restore some of this huge and growing inequality between amazing healthcare miracles for the wealthy and terrible health suffering for the very, very poor. And when we do that, and I believe that we can, we really will have built a better world. And one of the things that makes me optimistic is things like the expiry of patents. So even the most expensive medicines, which would have been impossible for the poorest of the poor to have, even without any changes to our legal framework, these things become available at extremely low cost, really quite rapidly in the very poorest of places. And we can see many other examples where these kinds of things are happening. So overall, what I say is this. You could hardly imagine a more exciting year in which to hold this event than today. With so many extraordinary advances in medtech, infotech, biotech, pharmatech, with so many extraordinary challenges and open doors to find solutions. With so many creative partnerships between government, between business, between hospitals, between universities, and this conference is absolutely an expression of all of that. And when you consider the number of new health startups in Korea alone, when you think about the new health departments inside your greatest giants like Samsung and other companies, then I do believe that this country in particular is set for tremendous growth of entrepreneurial, fascinating breakthroughs in every aspect of healthcare, and I wish you every success. Thank you very much.
Thank you, Dr. Dixon, for your wonderful speech. 오랜 시간 멋진 강연해 주신 딕슨 박사님께 다시 한번 큰 박수 부탁드립니다.